Senator Kaine.
Thank you, Mr. Chair. And Chair Sanders and Ranking Member Cassidy, thank you for making this the first hearing of this committee in the 118th Congress. I think this issue is huge and challenging, but one that's very amenable to some bipartisan work that can be done. Senator Romney beat me to the punch. Not the first time, because I wanted to talk about immigration. I was interested that in none of the opening testimony was this put on the table as a potential solution, although I think in some of your written testimony, a couple of you mentioned it. Just to give you numbers on this. According to the Migration Policy Institute, as of 2018, the foreign-born comprise almost 18% of the 14.7 million people in the U.S. who work in healthcare, nearly 1 in 5. The foreign-born make up a disproportionate share of certain both high and low-skilled healthcare workforces. 28% of our physicians and surgeons are foreign-born, and 38% of our home health aides were born outside the United States. And this isn't just about employment-based immigration. It's also focused on family and humanitarian immigration systems. So another statistic, more than 310,000 healthcare workers, 12% of the immigrants who are employed in healthcare occupations are not here on work-related visas. They're here for humanitarian reasons: resettled refugees, asylees, special immigrant visa holders, TPS recipients, and Cuban and Haitian entrants. So, President Herbert, you've already addressed this with Senator Romney, but what could we do with an immigration reform that's focused on healthcare or other critical workforce areas that would make all of your jobs easier in educating a diverse and sufficiently sized healthcare workforce?
So, Senator Kaine, thank you very much. First of all, I should say I'm not an immigration expert. I make no pretense to be, but I echo your concerns. I think that there's no question that immigrants disproportionately go into healthcare at various levels. They're very hard workers. They want to work. And I can tell you from personal experience, at least locally, what I see is a lot of folks who want to work. They're here legally, but they're not able to work because of arcane regulations that really should be changed. And so, we need, and frankly, we need to encourage immigration in a state like Maine, where we are losing native population, and the only way our population is staying stable and even growing is through immigration. And there's many new Mainers who want to work and are not able to.
My perception, and I don't have the data on this, but my perception in Virginia is that the foreign-born healthcare workforce is also more likely to work in rural Virginia. If I talk to physicians in Appalachia, they're more likely to be foreign-born than if I'm doing it where I live in Richmond or metropolitan, other metropolitan areas of the state. I have other topics I want to get to, but does anyone else want to weigh in on immigration issues? Yes, Dr. Hildreth.
Senator Kaine, thank you for the question. I have nothing against bringing in foreign-born folks to work in our healthcare enterprise. We have lots of talent we've not tapped into in our own country here. For example, it used to be that 26% of all the black students who went to medical school came from HBCUs. Is now less than 10%. Why is that? Because we've underinvested, under-resourced those schools. So I would submit to you that by properly resourcing the schools we have, we can fill a lot of that gap with native-born talent right here in the United States. Thank you.
I have a piece of legislation that is called the Expanding Medical Education Act, which I'm going to reintroduce this Congress. I introduced it in the last, that's very focused on HBCUs and other minority-serving institutions. In your testimony, and then Dr. Swanee's testimony, you both laid out some innovative programs you're doing and the need for additional investment. I completely agree with that. Let me ask a question about the direct care workforce shortage, or just bring it to the attention of the committee. Our direct care workforce shortage is often left out of the conversation about healthcare workforce shortages. Direct care professionals make an average of $11.75 an hour. They're some of the lowest paid workers in the economy, but they provide difficult hands-on care to seniors and people with disabilities. And this workforce shortage kind of compounds other shortages. I go to hospital emergency rooms and they say we have to keep people in hospitals longer because the direct care workforce shortage means that there's no placements where we can discharge someone from a hospital to a long-term care setting or to appropriate home health care aid. So I hope as we look at this problem, we'll focus on the direct care workforce. Finally, Mr. Chairman, I would like to introduce a letter for the record. Johnson & Johnson wrote a letter to thank Senator Cassidy and the whole committee for a bill we passed, the Lorna Breen Healthcare Provider Protection Act, which is to provide mental health resources to frontline healthcare workers. One of the ways we'll keep a robust healthcare workforce is making sure that they have the resources they need to be resilient. I'd like to introduce that letter for the record if I could.
Without objection.
Thank you, and I yield back.
Thank you very much, Senator Kaine.